Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next 45 minutes to an hour or so discussing one of the subsets within the Medicare market, and that is the folks that receive their benefits because of medical disability. The Medicare market is a very large market, obviously, and we wanted to piece out and focus upon a subset of that market that is perhaps a bit under-marketed compared to some of the others, but a great opportunity for folks as well. Today's presentation is being recorded, and it, along with some of the information that we referenced through the course of the presentation, will be sent by email to all who have RSVP'd to today's meeting, and it will include both links and attachments. So if you would, please watch for your spam filters in the event that it may be diverted there for you because of that combination along with a blind copy. If you'll notice in the software, there is a section for questions. If you would, put your questions in that section, and we find that generally we answer most of them through the course of the presentation, but we'll review the questions and make certain that you have an answer either at the end of the presentation or if it requires additional research, of course, very shortly thereafter. We'll start with a bit of level set about our organization. Premier Marketing is a national marketing organization founded in 1968, licensed in all 50 states. We're part of the Integrity Marketing Platform with offices across the country. We act as an insurance wholesaler, providing insurance product to the public through independent insurance agents such as yourself. And we do so with an arrangement with agents such as yourself with contracts at highest possible commission levels with recruiting contracts available to those who qualify. We do so through a full insurance portfolio that includes the Medicare programs to help with health expenses. That includes the Medicare Advantage and the Medicare Supplement programs and the standalone Part D plans. We also offer a full portfolio of life insurance and annuity products, including final expense and pre-need plans. Also offer long and short-term care programs and disability income plans and ancillary benefits that include dental, vision, and hearing programs, critical illness and cancer plans, and hospital indemnity programs as well. That Medicare Advantage portfolio includes the national carriers and many of the regional carriers that make a difference for you in your market. And that same philosophy carries over into the standalone PDP arena, where those national carriers are there for you through our organization. You'll note on this slide, it still references Envision RX. We have been notified in the last few weeks that that program is being pulled from distribution, from the broker distribution across the country, with all organizations being relabeled and handled differently. So we wanted to make you aware of that situation, and that's why that name is still on there. When you look at the Medicare Supplement portfolio, it's a very large and robust listing of offerings, and we also have specific marketing programs put in play to help you be successful in that arena as well. When you look at the ancillary products in each of those categories, the national leaders are there for you. These can be crucial in dealing with whatever segment of the Medicare population or the under 65 population for that matter, as an additional way to market, create an additional revenue stream, and of course, most importantly, serve the needs of your prospects and clients in those different categories to make certain that their coverages are as comprehensive as possible and offered through you as their agent. When we look at the Medicare market overall, you don't come on a meeting like this without someone speaking of the silver tsunami, the aging of baby boomers, 10,000 people plus a day, turning 65, one every 10 seconds. But if you look at it just based on age, we're missing part of the picture. And that's because there are a portion of the folks who turn 65 and don't immediately access their Medicare benefits upon that birth date. You'll see some people continue to work and defer coverages, and you'll also see some folks that have decided to continue within other coverages, and that precludes the need for the Medicare program off the bat. It's a percentage somewhere between, depending upon what you read, between 8 and 14%, but it's more than made up by the portion of the folks that we speak to today. and those are the medically disabled that make up nearly 1/6 of the Medicare population. And we'll be going through a great deal of detail on this segment in just a little bit. It is a diverse population with some health challenges. 2/3 of the population have 3 or more chronic conditions. And, well, with the median income now at about $26,200 as opposed to this $24,150, we have some budgeting challenges upon the different circumstances as well. So having a diverse portfolio of products to address the needs and the budget can be very helpful for us as agents to satisfy the requirements of our book of business. Once again, diverse population, all kinds of needs that come into play, and we see that in order to address the situation, we need to make certain that we have some working knowledge on the subset that we're dealing with. And what I mean by that is you'll see in some of the information we roll out here very shortly that some of the folks under the age of 65, different programs have a specific appeal, and there are reasons for that. Part of the reasons is everybody has choices. So as a person comes into Medicare, one of the first choices they have is whether or not they accept the Medicare Part B program. They don't have to. It's an optional coverage. The thing is, most people do, and most people should, obviously. They then have an additional question posed to them as to how do they handle some of the other expenses that aren't covered by traditional Medicare, and that includes the use of prescription drugs. There are certain medications that are covered under Part B in certain circumstances, but the scripts they pick up at the pharmacy are available only through private insurance companies and the Part D program that an individual has to enroll in individually according to their wants and their needs. So that's a choice that they look at. And then some folks will look at the shortfall that they have in the medical portion of it, the deductibles and co-insurance with traditional Medicare, and look to address that with a standardized, modernized Medicare Supplement plan, if they can, and if appropriate. Or are they going to go the Medicare Part C route, where sometimes those coverages are bundled together and are handled through private insurance companies again? In each of these circumstances, that will affect our topic today when we look at the folks who have Medicare because of disability, being under the age of 65, and how that has certain challenges for that population that we can address. When folks initially come into Medicare, we see near a even split as to their choices for their basic medical coverages. Medicare Advantage and Med Sups are great options for individuals. It depends on their circumstances, what may be best for them, but we also have a portion that seemingly stay on original Medicare only. This portion may include retiree coverage, however, folks who access care through the VA, perhaps Medicare, Medicaid folks. A number of different factors come into play for those who show as original Medicare only. So to help, to start out with, we want to make available a translator for you, because each segment of our society, it appears that we all have our own language with the area in which we work. Our friend who's a computer programmer, I don't understand what he says half the time. I need an acronym guide for that, I suppose, but this will come to you as a link in today's follow-up and could be a valuable resource tool for you. So when we look at how the Medicare market is booming and specifically address the medically disabled folks that are on that, sometimes it's nice to set a baseline as to what Medicare actually covers across the board. And there is, of course, now an app that individuals can download, agents and beneficiaries, the What's Covered app, that gives a good resource as to how certain situations are handled when it comes to billing and coverage. There is, of course, the old dependable Medicare and You, which is a little brushed up with the e-version, but generally, unless people opt out of this mailing, every Medicare beneficiary receives one in the first part of October for the following year. You have access to this material as well, and we'll talk about where you can get some additional detail there too. Basics, of course, you got the deductibles and co-insurance, and they apply with that per stay deductible on inpatient stay, or inpatient care, I should say. where you have the per stay deductible and the daily rate if you're in the hospital too long, and you have the Part B coverages that have the shortfall with the annual deductible and the 20% co-insurance on covered charges as well. I should say that covered charges across the board because Medicare pays only on what coverages they deem necessary and have a payment structure for. So it gives us then an opportunity to address those shortfalls with whatever population we address, but we'll see in this population how, well, we have to look at some different possibilities in certain circumstances because of governmental regulations and the practices of different insurance carriers offering coverages. Medicare itself, well, most of us know the history, and we realize that it was established in 65 as a program for people 65 and older. In 73, it added coverage for those under the age of 65 who receive Social Security disability insurance, and to qualify for that, they have to go through different application processes and be, well, noted that they have to have certain challenges with either a physical or a mental impairment that's going to last at least 12 months or until death. They also cover certain widows and widowers under 65 with disability and certain disabled people, be they adult children of those retired, deceased, or disabled people. When a person under the age of 65 with disabilities on Medicare turns 65, their coverage continues, but they have different options at that particular point in time that we'll discuss as well. When you look at the overall population that is on Medicare and medically disabled, we see that that percentage has really grown over the years, nearly doubled since 73. And the folks that have this coverage have some similar things that you can associate with the population. And you can include within that lower incomes in many instances. Because of the disability or other circumstances, they require more health care. They sometimes find it difficult to pay for and obtain that care. So access is a challenge. And then, of course, covering the financial responsibilities. Many of them are more likely to have cognitive impairments, might be the cause of the disability. A good number of them report themselves to be in poor health, and many have limitations in one or more activities of daily living. If that rings a bell, that's one of the factors that comes into play when activating long and short-term care policies. When you look at this circumstance and how people get coverage when they're under the age of 65, we see a much larger share of these folks in comparison to the older beneficiaries on Medicaid to supplement the Medicare coverages. The percentages are pretty substantial, 35 to 10%, because of those incomes. And because Medicare and Medicaid can help cover some of the other expenses within the initial program, it's important to be cognitive of how we can also help folks with those coverages and what that opens for us when it comes to different sales possibilities. So a little bit of background as to what they have for coverages. You'll find that the folks under 65, obviously, because they're disabled, many of them aren't working. So you see a smaller percentage that are covered by employer-sponsored coverage. You'll see some folks that qualify for disability and may go back to work and still maintain Medicare, but that's still a smaller percentage that we see of the folks that most people think of Medicare, and that's the over 65 population. You also see a much smaller percentage of these folks covered by Medigap, and there are reasons for that, obviously. The Medicare Supplement companies are required to offer a particular policy if they're offering other med sups in that state, but it may be restricted to a particular type. And as people look for that coverage after they have coverage in play already with Medicare, they may be required to undergo medical underwriting, which causes a challenge for many disabled, and have other circumstances that can limit the choices they have in that type of coverage. You'll see also that these folks are interested in Medicare Advantage programs, and in certain circumstances, that is a good fit for them. When you look at some of the challenges that base coverage, the deficiencies in that base coverage have, it also creates a challenge for these people when they go to seek care. Many of them are reluctant to go to the doctor because they don't have the financial means to cover it. And so they feel they need to go but don't. And for most of these people, many of them have the main reason that it costs too much. So providing options to help with that expense really helps, not just with the financial situation, but the overall health and well-being of the folks that we have in this population. Some of the things that these folks also see is a self-image of where they have some different challenges on their health, and they view themselves as being unhealthy in certain circumstances. And many of these folks have not just 3 chronic conditions like the general population listed. You'll see nearly a third of the population have 5 or more. So there are health concerns that we can address by helping them identify caregivers as well, which is all part of our discovery process in our discussion with a beneficiary anyway, in order to help determine what might be their best coverage. Because obviously one size doesn't fit all. And when they look at some of the base choices on the Medicare piece of it, going the Medicare Supplement route versus the Medicare Advantage avenue that they can follow, of course, there are good, bad, and ugly on each side. So going through and looking at some of the specifics on the choices within the base medical can be helpful for us. You have access to, obviously, the Choosing the Medigap policy guide put out by the government as well, and that gives us information as to what is available for the under 65 Medicare population through a Medicare Supplement program. And as we mentioned before, well, federal law doesn't require the insurance companies to sell Medigap policies to those under 65, and many of the folks that are under 65 won't really have a good option in the Medicare Supplement world until they reach the age of 65 and the full gambit of policy types are available to them. For some folks, even if they can buy a Med Sup, it's going to cost more, and we got to look at the coverages that come with it. At present, a Medigap policy isn't available for those with ESRD under the age of 65. It will be interesting to see how some of this is addressed as the ESRD question is eliminated from the MA portion, and those folks are rolled into that regular coverage. I don't anticipate any changes on this half of it, but that may influence their choices. When you look at the availability of Medigap plans across the country, these are the states that require the insurance companies to offer at least one type of Medigap policy to folks under the age of 65. For folks active in this market, most realize that in the standardized states, that's usually a Plan A, and we'll talk about what you get for what you pay there. But it's a nice listing of these programs, and you'll see that as new carriers come into an area, their plan choices aren't necessarily the full gambit, and for some of them, they will limit it to 3 or 4 of the more comprehensive coverages, and if they're in one of these states, you'll see a Plan A as well. Some of the things that we also see is when a person turns 65, I mentioned this briefly before, the fact that at age 65, they then have an opportunity to pick up a Medicare supplement without medical underwriting in that guarantee issue basis. This gives us an idea as to how we can discuss future plans with the folks we address as well, because let's say they are 52 and disabled. In 13 years, well, they have a different type of option for Medicare supplements than what they do now. So it gives us an opportunity to see just what is available where, but these coverages and their requirements can vary from state to state. So working with the State Health Insurance Assistance Program, the SHIP programs, you can really verify that in your state, these are the options available to the under 65 folks in the state of wherever you live. Because the Medicare supplement programs have been standardized, modernized, gone through all kinds of litigation and different types of, not litigation, legislation is the word I'm looking for. you'll see that in the vast majority of states, the benefits are the same. The basic benefits are the same across the board. A Plan F is a Plan F is a Plan F. Some of the carriers may offer benefits in addition to that, but the basic benefits are the same. That can and does vary in 3 different states. In Massachusetts, Minnesota, and Wisconsin, the Medigap policies are standardized in a different way. So if you're marketing in those states, we need to really make certain that you're aware of the differences in those states versus some of the others. As I mentioned before, the insurance companies don't have to offer every Medigap plan. However, in the standardized states, they have to offer the Medigap Plan A if they offer any other Medigap policy. And they may offer Plan C or F if they offer any plan. With the macro legislation coming in now, you see more of an emphasis on the G for those who hadn't had Medicare before January of 19. This chart kind of gives you a nice illustration of those differences that are available, or the plan types that are available to folks depending upon when they access their Medicare. And this applies across the board for all Medicare recipients, even if they are under the age of 65. The challenge is some of the plans may not be offered to that population. So you'll see that depending upon the plan choice, there may be other avenues that we need to pursue to protect our population that we're serving, be it the traditional over 65 folks or the folks that are under 65. The options are different. And you have help determining where that comes into play as well. The quoting engine that we offer without cost to our contracted agents does give you the opportunity to go in and examine those different Medicare supplements that are available in that zip code of residence for your prospects and clients. And it will also tell you then, well, gee, that plan's not available, or this one is. So you have a great way of offering a review through this tool, regardless of the age, and that preparation and that shared knowledge can help you with the options that folks have when this may not be viable for them. When we look in the Medicare Advantage arena as a option to cover these folks, well, one of the things that really helps in this regard is the fact that the basic eligibility factors are relatively simple. The person has to have A and B, they have to live in the service area, and at this time, they cannot have end-stage renal disease. That does mean, however, that, well, that particular requirement's going away for 2021, and Medicare Advantage programs will accept ESRD folks, but put that in context. So if you have Medicare A and B, that means you can't be too young or too old. So that helps with the delivery of the same benefit package, even if the folks are under the age of 65 and accessing Medicare. It also means that the program is not medically underwritten. There's no questions here about health circumstances outside of ESRD right now, and that goes away in 2021. So it's not a question of medical underwriting or any type of layout clauses or anything else that comes into play. The benefit package is the same across the board, regardless of the age of the participant. It is an interesting scenario, too, when we spoke of some of the challenges that the people have when it comes to income and assets that are under the age of 65. You can really see that this demonstrates that some of the lower income folks are influenced heavily by this. You know, it's a kind of a chicken or egg type of thing. Were you challenged with resources because you were disabled early and you didn't have as much time to earn dollars for Social Security or other means of support through private investment? Or is it a circumstance of, okay, this illness cost so much, I didn't have the coverage, access was a challenge, I had to spend down much of what I had in savings, and I'm not earning things now because I'm disabled and not working. So it creates a circumstance where the assistance programs that we speak to with all the Medicare beneficiaries, the extra help with the drug coverage, the Medicare savings programs for other expenses that may be particularly viable in this segment of the population. And if they are a true dual beneficiary, you have additional opportunities then in the dual special needs programs to further enhance the benefits that are available to these folks should they qualify. Pretty much the same across the board when you look at male versus female. You do see a heavier enrollment of females into the Medicare Advantage programs than male in the disabled population. And you see, particularly when you look at the income range with this, when you're looking at basically the median down, that's the bulk of the folks that are falling into the medically disabled. Not to say that all of them are without financial means, but the majority of them have some challenges in that area. Utilizing the Medicare Center tool can really help you in that regard then of identifying choices in the Medicare Advantage and PDP arena for these folks to closely tailor the coverage to the needs of the individual and give them the information to help them make the choice that's best for them. There are certain circumstances as well where an individual may not be able to qualify for or afford a Medicare Supplement plan, or if they do in this population, they need to pick up drug coverage. And so knowing some different things about how we can address specific needs on an annualized basis with this population, be it with the standalone PDP program or the drug benefit embedded in an MAPD plan, is crucial in maintaining the relationship that we have with these individuals. Many circumstances, their medications may change, and we know from experience that obviously the formularies and the tiers within the drug coverage can change as well. So utilizing information available from the government and from the tools that you have available can make a big difference on helping those individuals address their needs, both with getting the coverage and the access that they need, but also handling those costs. Because we see a much larger percentage in this population skipping, not filling, not abiding by the regimen that's been prescribed for them, simply because in many circumstances, it boils down to cost. So knowing how we can support them in that area and drive down some other expenses can make it a vital part of our presentation and give us an opportunity to serve those individuals. Kind of a synopsis of that chart. So we see that these folks have challenges with the cost of the medications and then worry about it on the back end as well. And in many cases, then avoid going to the doctor, creating a circumstance that's contrary to their health circumstances and exasperates their situation. Once again, utilizing the Medicare Center tool can give you information about the options they have should a standalone PDP program be in their best interest, and gives you the opportunity as well to review that coverage year over year. As I mentioned, since many of these folks have some challenges with their finances, being aware of what it takes to get coverage as a dual eligible can be very helpful for you as well. This is an area that alleviates a lot of the financial anxiety and stress. However, it also creates an opportunity for us as agents to work with and explain the dual special needs programs. And while Medicaid will cover much of the shortfall of the Medicare programs and alleviate some of the cost, the extra benefits that people can obtain through these dual special needs programs can become of particular assistance to the folks that are disabled and under the age of 65. You've got different ways of accessing that information as well. The different carriers will help in determining the level of assistance that someone has, and in many circumstances, they have programs to help them qualify for it as well. The National Council on Aging here does offer us the benefits checkup service that helps us determine if they qualify for that additional assistance or any other type of program that might be out there that could help them. Help with cost of their energy bills, different things of that nature can really come into play and make us a valued resource and make us much more referable. which is a way of obviously getting into more households. Having this tool, the Medicare Center tool, can make a big difference because it gives you the opportunity to look at Medicare Advantage plans and PDP programs and compare them compliantly. It gives you the opportunity to do different things electronically to help serve the population, this segment of it particularly, since many of them may be much more computer literate than perhaps some of the older individuals. Don't mean to make such a sweeping generalization, but for those of you who have kids or grandchildren that are young, you can see them work on a computer and you are still looking for the on-off switch in many circumstances. It also gives us an opportunity here that if an individual is in an area, can't afford a med sub, Medicare Advantage plans aren't to their liking because of perhaps a network requirement or for whatever reason, there may be some stopgap measures that we can use to help with some of those expenses. Many of them fear the hospital stays, and utilizing a hospital indemnity program could at least alleviate a portion of that stress. It's not the ultimate solution, obviously, but it is there for you as a last resort as well. This population also has some challenges that we see across the board with folks with not realizing what is and is not covered by Medicare. Hence, we have the tool up front to say what is. On page 49, it tells us the specific things that aren't. And that includes a lot of the dental, vision, hearing needs that can be addressed through the quote engine as well, but also address specific needs of a population that may be much more in need of this than some folks that are older. That includes people who need help with their teeth, and we see that, of course, oral health can have a big influence on an overall, not only outlook at how healthy you are, but it can also help reveal other challenges with your health through tests that the dentists do as well. Getting that additional assistance for vision and hearing can be very helpful as well. One of the things that is a shortfall for this population too is, of course, the same thing that we see for the general population, and that is the planning for the inevitable, where the burial benefit through Social Security, if they qualify for it, is a $255 benefit. So they may need help in that arena. Another discussion for another time, since this is a non-health type of product, but that quote engine can help you with that as well. We have a number of trainings that can also help you understand and have the tools to address some of the specific needs of this population. And it parallels what we see across the board with folks of any age, but of particular needs for us is making certain that we know of the particulars for the extra help and other assistance programs, so low-income subsidy and Medicare savings plans, having a grasp of how those programs can affect not only the cost of the coverages for this population, but how it can alleviate some of the access concerns that they have with getting into individuals that can help them with their physical problems, the doctors, the specialists, across the board, those folks that provide the care. That is particularly helpful for you. And then, of course, being aware of the enrollment programs to handle them efficiently and compliantly, and knowing the basics of the Medicare in the Medicare 101 can really be helpful. Because benefits do vary from area to area, obviously, and from carrier to carrier, it's important to have that information available to you so you can address this population. We have that information on our website for you as well. Depending upon the market that you're in, we can also do an analysis off of the CHG tool, which will tell you at present what type of market penetration a particular carrier's plan has in the area that you're speaking to or speaking of with your prospects and clients. Government does give you some help too on different training pieces that come into play, and it includes this piece. It is a very comprehensive presentation that is available on the Medicare Learning Network. We didn't incorporate it into this presentation in its entirety because this is probably an hour and a half type of presentation by itself. This will, however, come to you as part of the follow-up, and it gives you some really valuable information on understanding the situation that the medically disabled in Medicare face. It goes through and it speaks to how people qualify and gives you background, historical background as to what is and isn't covered and how you can help people, should you choose to do so, who are disabled to get Medicare coverage. I have a sister who has rheumatoid arthritis. She qualified for Medicare at 62 because of her disability. And it took a little bit to get there as well. And you'll see that this will go through and speak to what the costs are of the program, depending upon how long the individual is working and some of the different programs and how to access and apply for those benefits. So that will come to you as part of the follow-up to today's presentation as well. All that said and done, the background that comes into play, we realize that this is a subset of the Medicare population that we would like to market to. The question is, how do we find them in many circumstances? And a lot of it will detail into some of the prospecting that we do for the regular population. But since we are in a unique situation now with the pandemic and COVID-19 affecting face-to-face meetings versus virtual meetings, we need to be prepared to pivot and have that information available and the tools available to help the people should it be in a virtual situation as well. But that can apply no matter how we locate these individuals. There are different programs that are out there that do allow you to cold call. You can still cold call for Medicare Supplements or final expense or dental. You can't for MA or PDP programs, but there are a number of dental programs out there that are discounted for individuals that aren't age 65. You'll see a fairly sizable increase in the premium on many of the programs when that person turns 65. So selecting a list of individuals that are close to that time period may help you find individuals who are medically disabled as well and have a need for your assistance in the base medical beyond the dental program that you may be calling on. And that's a fairly simple pitch as well. You, of course, have other options for products to reach out for or as using as the thrust of your conversation. And we realize that at this particular point in time, many folks are at home and are answering the phone. There are also different community-based programs that can help get you in front of the population that we're looking for. Medicare in general, disabled specifically, the retail programs such as Walmart and some of the other programs that carriers offer. Well, the disabled, they shop, they pick up their groceries, they pick up their medications. It's a viable means of reaching that population as well. And sometimes that is an area where you need to remind the folks that work at the pharmacy that send you people to your table or your booth or whatever it happens to be, that, hey, Medicare is more than 65 plus. The medically disabled with Medicare, I can help them too. So it's just a reminder in that arena that can really help address this population. There, of course, are different faith-based organizations that deal with the disabled as well. Many of them have outreach programs that can be helpful into the population and can be a very valuable resource for you across the board. The providers, obviously, doctors who treat these individuals can be a great source of referrals. We have programs set up on helping you market to providers as well. That goes beyond the providers that are doctors and specialists. That may well include purveyors of durable medical equipment or folks who provide home health care. Great avenues of referrals too. And then, of course, there are different centers of influence in the community that may be senior centers. They may be outreach people out of a hospital, different programs there that could be of great influence for you with the population. Different carriers do offer different programs to reach out to individuals too. We're aware of that, but particularly in the Medicare Advantage and prescription drug world, if you're working with a carrier and have a good relationship with them, you kind of see the you scratch my back, I'll scratch yours, quid pro quo situation. where you may be getting interest from this population through a carrier itself. You can, of course, reach out through social media, different campaigns that are out there. We're seeing a number of the Medicare Advantage programs come out with templates for you to use in social media campaigns, different hints and tips as to how to approach the population. And then, of course, you see social media as much more of a standard within our society today of immediate gratification. A mail campaign or an investment into the community itself may not get the same sort of quick return that you would get with social media. We cannot discount the value of referrals in reaching into this population. Many of the folks that have a particular health challenge know many other people that have that same problem. And so a referral can be very, very helpful in this regard. And then, of course, there is direct mail. When we look at social media, we have a couple of different programs that can help in this regard. A program for Med Sups and for final expense. This is an area then that helps us with the compliance component. And you'll find that some of the folks that reach out for Medicare supplements may not be of the age of 65. They give you an opportunity to discuss those different options that they have, and that they then may find themselves interested in additional coverages that they may not have been aware of until they were educated about them. So these programs can have value for you. We want to emphasize the referral piece of it. And then, of course, the direct mail support is based on production, but it deeply discounts the cost of that mail and gives you the opportunity to perform with this system on a consistent basis. It's like an exercise program, direct mail. Sometimes if you do it just once, you feel a little bit of pain. If you do it consistently, you see the results. And that's part of putting a direct mail component in your marketing program and realizing I'm going to budget this much for it, but I'm going to do it consistently. These are the preferred vendors that we use in our mail subsidy program. The top row deals with the Medicare Advantage and Ancillary programs. The lower level are the vendors for the final expense program. Keep in mind that mail assistance is two separate programs. So you could qualify based on Medicare and ancillary programs and additionally qualify for final expense as well. We do also have a program that gets you access to mail returns without going through and financing an entire mail campaign. They're sold as one-offs. You can purchase them in any type of numbers. It's just with these, they've never been distributed before. It's when you run your own campaign, you can call someone immediately when the response comes back, and we know that's much more effective in certain circumstances. So when we specifically look to locate the disabled, there are some different things that we can use that are outside the realm of normal Medicare prospecting, and that includes associations with folks that deal with this population on an ongoing basis. Specifically, disability law firms. We see a number of agents that have developed a relationship with these firms. We've seen some firms create their own insurance department to handle it as well. But these then are individuals who are new to Medicare in many circumstances, which of course affects the compensation on this end as well, because it's first year commission versus renewal, and that can make a huge difference. Pretty simple to find these guys. Google is a wonderful tool, and it will help you come up with contact information for folks in these law firms to create that conversation. Social Security offices can be of help as well, making those individuals aware of some of the things that you do on an ongoing basis can create referrals for you. Some of the folks obviously within those offices, they're government employees, and they may not send people to you, but they'll make them aware of the possibilities that they have, and depending upon your relationship, well, it can work that way. There are also social workers out there that need to be aware of the fact that the under 65 population can be served very well by an insurance agent such as yourself, and developing relationships with these individuals can be very helpful. When I was in individual production, I used to help co-sponsor meetings for social workers and in conjunction with long-term care agents as well. I wasn't much of a long-term care agent, we'll admit that, but social workers require continuing education courses, and working in partnership with long-term care agents, many times they have presentations that are qualified for continuing education, and working hand in hand with them really drives your influence in this community. Then, of course, the providers of care that we did mention before, the doctors and specialists, you throw in hospitals as well, durable medical equipment companies, the different home health care agencies that can be very pertinent to this area as well, and then different community support organizations. You'll see different awareness programs, sometimes based out of a hospital, based on certain type of illnesses, and they quite frequently look for speakers. And then, of course, there are folks that, well, hey, I'm disabled because I have diabetes, and it progressed to the point where I've gone blind, or I've lost a leg, or whatever the circumstances happen to be. So working in conjunction with some of the national organizations that deal with specific illnesses can be helpful for you. American Diabetes Society Association can be helpful. You can also find folks through where they live. And this is actually a live link that you'll get that speaks to supportive housing for people with disabilities. So you'll see in many of the government subsidized housing units that there's a requirement for them to accommodate the disabled. So working with these residences can get you in front of individuals as well. And you'll find in many circumstances, if you go to subsidized housing, there are a lot of people approaching those individuals to purvey the different options that people have. But most of them are approaching it with the senior citizen type of mentality. When you go in and you speak to the whole of the Medicare population, that's a different twist. That's something different that many of the managers in these different facilities haven't been made aware of as much. And it gives you the opportunity to address not only that population, but give a Medicare 101 regardless of the age of the Medicare beneficiary. And so you're capturing the whole market, but you are utilizing your knowledge of the under 65 medically disabled Medicare recipient as a door opener into those facilities. And then, of course, the different caregiver programs, that's also available for access. That gives you an idea as to where some of these associations are and how you can address not just the beneficiary, but in many circumstances, the folks that help take care of them. And we're all aware of the fact that there is a lot of uncompensated caregiving done by family members. This can help alleviate that pressure, but it also gives you access to another individual who may be part of the decision of healthcare choices for the disabled that you're looking to visit. Some of the things that we can do to help you as well to prepare for these different situations is making certain that your contracts are in place with the different programs that address these needs. When you speak to Medicare Advantage and PDP programs, that does require certification ahead of time. And so what we're looking at with this is basically creating an agent profile where you can have all your information and pick up additional carriers to help address those needs that may not be just MA or PDP programs. Not every carrier accesses or allows access through this system, but a great deal of them are, and particularly when you get into some of the ancillary benefits with dental, vision, hearing, hospital indemnity, critical illness cancer plans, different programs of that sort, you can use this program to contract with multiple carriers, and the contracts are filled electronically. Makes your life easier. We also help protect yourself and your ability to earn, and that is through a discounted E&O policy that we have in conjunction with 360-degree coverage pros. This is not like adding you to a blanket discount or a blanket E&O policy for a particular carrier. This is a program that you own and covers you regardless of whom you contract through for different products. And it even includes some variable coverage, which is getting much more difficult to find. Your licenses, we can help with the CE in that regard as well through our relationship with WebCE, discount the cost of those programs to keep your license current. And as I kind of alluded to a couple of slides ago, you do also have a way of adding to your own benefit package through a modified guarantee issued non-cancelable disability income program that is offered at discounted rates where you share in the commission. So it's a great way to add to your own bundle of benefits as well as an independent agent. Much is where today's presentation is being recorded and will be made available to everyone through the email. We also post them on our website at premiersmi.com and on our YouTube channel. And it speaks to not just different marketing concepts and the scope of individuals that we have to access information for, but it also gives us then the opportunity to look at different marketing tips, specific product information across the spectrum of our industry. Don't discount the value of those electronic tools. We offer 2 programs at present, a third one rolled out very shortly, and it gives you the opportunity to handle some things effectively, efficiently, and compliantly through electronic means. And in today's world, when we don't really know when the current situation will pass, or if it reoccurs, or whatever, we need to be prepared to help people with whatever means possible. And we have actually seen over the last few years a much larger percentage of agents that do the applications electronically anyway. This is then a tweaking of that situation and doing it remotely as well. Since the different carriers do pay differently, where the Medicare Advantage and PDP programs are standardized in their compensation, there are additional incentives offered by carriers for certain products that we have the information put in one place for you. So you have those additional incentives, which is really in vogue with ancillary and med sup programs and even some final expense programs, and then different carrier trips. Production in those areas do help you qualify for Premier's producer convention as well. So all this said and done, what we're looking to do is look at different parts of our target market and help you earn their business as we earn yours. And we want to make certain that you are aware of some of the subtle differences that are available in the Medicare market, and that you have a means to recognize and address the needs of subsets of that population. It's the general Medicare population. It may be the dual beneficiaries, be they over 65 or under 65, or addressing the medically disabled specifically because of some of the challenges they have with budget and access. I don't think we can emphasize too much how these programs can really not only help people pay for the coverages that they're seeking, but also actually be able to access the care in order to address their challenges. Oops, pardon me, went a slide too far. This is an area that is a little more nebulous than just a general outreach, because it's simple to, okay, I'm going to do a mailing of 65 to 80. Boom, most of those folks are going to be on Medicare. Can you actually do something from 35 to 64 for disabled? Well, you're going to cast out a net, and you're going to have a whole bunch of people that don't qualify. So we need to make certain that we're accessing these people in a manner that's effective, obviously, so we can see the end results, but it'll take a little work on the front end in order to get in front of them, but it is a great way to get paid twice. And what I mean by that is you're paid your commission, but you also get that intrinsic reward of knowing that you really help a population that really needs your assistance. And in many instances, they don't know where to go for the information. Some of them may read on the internet and be confused. Some of them may read mailings and get confused that way. Or some just sit there and be confused anyway. Having the information at your fingertip utilizing some of the data you have seen today and that you'll receive as part of the follow-up can really help you in that sales situation. So watch for the follow-up that we're going to send to you. You can reach any of us here at Premera through our toll-free number at 1-800-365-8208 or through our website at premiersmi.com. I'm going to check here for questions just to make certain. Oop, I caught somebody who caught me coming in at 1 after the hour. My apologies. Appreciate the compliment. It appears that we don't have any additional questions. So I want to thank you for the investment of your time with us here today. Watch for the follow-up that we will send to you as soon as the recording updates. And until we speak again, we wish you good selling. Thanks so very much, and we'll talk to you soon.